Thank you, Dr. Eisner. Thank you for those pearls of wisdom. We're going to continue exploiting your experience and expertise as we move forward. Our next speaker for the afternoon is where is she? Okay, so we're just going to wait till she steps back in. And she's I think I've known Sara for over a year since the last Dominican conference. That's when things started, and she's a wonderful person. She's a hygienist for, I'm not going to say that number again. You've already said that. It gives out her age. I didn't want to do that. So she's an excellent educator. She's been working on oral wellness for the last 10 years of her career, and how everything comes in together. I didn't say that 30-year thing. It wasn't me. I just stuck to the 10-year part. So for the last 10 years, she's been focusing on oral wellness, and we're grateful that she found the time to talk to us today. Thank you. And
so I'm really happy to be here, and I'm excited for all of you to enter into this amazing profession that we're in. I've been in dentistry myself for 31 years. Started out as a dental assistant, moved to the administration, treatment coordinating, became a hygienist, and then after I became a hygienist, I actually became a holistic nutritionist as well. And in the last 15 years, I've spent my career educating, consulting, and putting in patient-driven programs in the dental hygiene department of dental offices. A few years ago, I met Dr. Eisner through an article that I wrote that I didn't think anybody was really going to be interested in it, because oral wellness and health and wellness has always been a part of how I've treated my patients, but I didn't think anything would ever amount to anything. So I was asked to write an article in 2014. The editor called me up and said, "Sara, we're going to put this on the front page of the Oral Hygiene magazine. I think it's an amazing perspective that you give." From there, I can't tell you what has happened to my journey in this dental profession. I met Dr. Eisner, who shared and aligned in my philosophy of care when it comes to patients' health and wellness through the dental practice. And we created OWL. OWL is Oral Wellness Learning Institute, and what the aim and focus here is really to help dental practices put a system in your office that's really going to make your practice unique in your dental hygiene department. And as, what was the gentleman's name? Was it out there? You're breaking down the place here.
For you, I would break the building.
I thought he's going to be renovating anyway. So I know that there's a lot of talk in dentistry that, there's too many dental offices, the market is flooded, there's a dental practice every 500 meters, and I get excited about that because my vision, thank you, is a little bit unique in the fact that I think if we adopt this whole person-centered care practice, this one here, thank you. I think that once we have a dental office every 500 meters and we adopt this way of helping our patients, we're actually going to help healthcare. Because dentistry, you're all dental providers, but you're also healthcare providers. And you can't look at yourselves as just, this is my arena and that's it. Because what I'm going to share with you in a moment is really all about the oral systemic links and how that's actually changed the way we do dentistry. For me, it's been my whole hygiene career. I'm the type of person that I don't take an end stage problem and just say, oh, well, that's it. I'm very inquisitive. I'm a big why person. I was always, why does this happen? And it's always been that way with my patients. And that's why I became a holistic nutritionist. But the oral systemic links, and this started way back in the year 2000 when the Surgeon General came out with a report stating that the oral health is also linked to the overall health. And from then, this is 17 years forward, the research has amassed for years and years and years. And the data that we are collecting and looking at dentistry is not just the body starting here. okay? The body actually starts from the head. And looking at this whole perspective that the mouth is important, what happens in the mouth is important to the overall health. So that was really the kickoff to this whole oral systemic link. So many people 20 years ago when I was talking about cardiovascular disease and gum disease, they were looking at me like I had 3 heads. But I've aligned with many companies. The Bale-Donine method is a preceptorship program that I did a few years ago. They are the leaders in what they call arteriology, where they study the artery wall. And they're 2 physicians. The reason why I lined up with them is in all the years in dentistry, I found that Dr. Bale and Dr. Amy Donine were the first practitioners from the other side, from the medical field, that actually included dentistry as part of their overall scheme of helping patients to prevent heart attacks and stroke and their risk assessment. So it actually included us people, in this whole paradigm of helping people with prevention and cardiac risk and assessment for heart attack and stroke. The Journal of American Periodontology, I mean, every edition, there's always something, new data, new research, sharing the link and understanding that the mouth, especially cardiovascular disease, diabetes, are something that we definitely have to look at. How are we going to, treat our patients? I know you're new in the area, but Ann Bosey has basically spent 70 years, and she's a local Canadian. She's from Toronto. She has a company in the East End. She spent her whole hygiene career. She's a hygienist, and she spent her whole hygiene career focused on microbiology, the oral systemic links, the bacteria that gets into our system and affects us systemically. And she has dedicated her whole career to this, a big mentor to me. So one of the things that I like to share, let me just make sure I get my clicker right. Okay, so one of the things that I like to share, a few people that have seen my presentation before, I like to show this clip of this movie. It was the first ever medical documentary done with a dental perspective. Okay, it was not done by any dentists at all. It was actually done by medical providers. And it's really about talking about inflammation and periodontal disease and the impact on our overall health. So I'd like to take about 4 minutes just to kind of show that clip. We can, yeah.
A nation can only be as strong as our health, and we're not doing well now. We have twice the chronic disease of Europe and 4 times that of Mexico, Japan, China, and India. 75% of our medical costs are caused by chronic disease by things that we can prevent. Only if America stops the influx of chronic disease. Only if each individual stops their own chronic disease can we lead in healthcare and can America be a vibrant country with a high standard of living.
Within creation of health, we're helping to take a person who is not yet sick, has not developed a problem, and prevent them from ever going down the path to sustaining that illness. So as I'm identifying patients with disease, I would have a subset of patients who I couldn't find a cause for the problem. Well, then when I discovered the amazingly strong association between mouth disease and the things that I do treat, like blood pressure, diabetes, heart attacks and strokes, even things like pneumonia, and a whole long list of systemic diseases that can originate from disease in our mouth, that was another turning point in my career. Once I looked inside the mouth, I found the source of a lot of problems in people who otherwise might not have had their problems identified.
The mouth and the rest of the body relate anatomically and functionally, and that's why the oral systemic connection is absolutely inherent in the way we're put together.
From a disease standpoint, when we have different situations in the mouth, we respond, our body responds with inflammation, and that's where we start the inflammatory cascade that's affecting most of these inflammatory diseases. One should think about this. Inflammation, and there's a concept called inflammatory burden. when you get more inflammation in your system, the accumulation of that will have a tipping point where you tend to have inflammatory disease. Inflammatory diseases are heart attacks, strokes, diabetes, rheumatoid arthritis, various cancers, kidney disease, pancreatic cancer, the list goes on and on and on.
We're in a state of chronic inflammation, and that's the basis for every disease that everyone has. It's the basis for cardiovascular disease, it's the basis for cancer. When you're dealing with periodontal disease, there's this entire inflammatory cascade going on that people don't understand. When you get a cut, for example, okay, your body is set up to heal that cut, and that goes through a process of an inflammatory response to solve the problem and resolve. If you always have a chronic inflammatory bacterial condition in your mouth, then you never turn off that process of inflammation. In other words, it never gets the opportunity to resolve and go away. There's just too much. The body can't react to all of them, and the body gets sick.
Periodontal disease, periodontitis, gum disease, whatever you call it, it all begins with bacteria. Bacteria are microscopic organisms, and in your mouth, there are billions. Over time, these bacteria can stick together and multiply over and over again. They can then form a colony and join together to create a thick layer called a plaque biofilm. Then, over a short period of time, it can dramatically spread throughout all of your mouth, teeth, gums, tongue, cheeks, everywhere. If there's an opening in your bloodstream in your mouth, the harmful bacteria can enter, causing the body many sicknesses. But there is another problem that occurs in response to the bacteria as your body tries to fight back. Inflammatory cells are triggered to try and kill the bacteria. But bacteria build their own strong defenses and battle back. This microscopic war ensues, and the result? Chronic inflammation. And inflammation is the basis for so many diseases.
Scott says you're a really scary voice. What do you think when you see something like that? It's scary, but I get excited. I get excited for you all, and I get excited for our profession. Because for me, I always felt that our profession was kind of, the doctors are the doctors, and the dentists, well, they're not really doctors. They're dentists, right? And I really don't believe that. I really believe, and it's because of biofilm that and the oral systemic connection that has made us value what we really can do for a person's overall health. In some countries, in the UK, I know that before a person gets, has to have surgery, they need clearance from the dentist. And I work with, like you're shaking your head, because I work with a lot of dentists that have come from Poland and other countries where they say, Sarah, it's backwards here. Usually, we have to clear it first. The dental provider has to clear before they can have surgery, and it definitely makes sense. The systemic link, so it's really more about so where are we going to operate as dental hygienists, as doctors? Are we going to operate from the perspective that patients in today, we're going to have a cleaning, and then they're going to come, we're going to clean their teeth and make them nice and shiny and white, and they're going to go home? Or are we going to operate from a different perspective? Are we going to operate from the patient as a whole person, what they actually come in with? Do they have systemic diseases? Are they a cardiovascular risk patient? Do they have any respiratory infections? Are they seniors? Are they elderly? Do they have diabetes, osteoporosis? Are they a cancer patient? When you change the way you look at your patients, and this is what we spend a lot of time in OWL, what I spend a lot of time with my dental practices that I help coach, is that when you change the way you look at your patient and you operate from this perspective, there's the systemic link knowledge, you're going to start treating them differently, and you're going to come up with treatment plans that are different than maybe the dentist down the street. It's all the way you look at it. But first you got to kind of know about the oral systemic links yourself so you can actually talk about it with your patients in a manner that's going to help them understand that, you know what, you need more than just a cleaning, Mrs. Jones, because, you know, things are not working well in your mouth. And that's the whole point of, sorry, I'm not hitting this right. So really, you know, there's so many diagrams out, and a lot of offices have these kind of pamphlets in their office to kind of motivate patients and to start the conversation. And if you really, in my opinion, want to be successful and have a different type of practice, you want to start thinking about what is your hygiene department going to be like? What are we going to implement in our hygiene department that's going to make us different than Dr. Jones down the street? And when we treat the whole person, I think you're always going to win. When you treat the person from a whole person perspective, you're always going to have the referrals, ambassadors for patients, patients that really value what you do. And it just, when you treat the patient, everything else follows through. Sorry, a little bit of this. So in 2012, this came out from the American Heart Association, which kind of made oral systemic health educators very, very excited. They basically came out with a level A evidence. Now, level A evidence, you're all in research, you understand that when you learn about research, level A evidence is the highest form of evidence that you can get with research. And they found that periodontal disease is an independent, standalone risk factor which is associated with arterial disease. Now, I got a lot of phone calls after the study came out because they said, well, Sarah, you see, periodontal disease doesn't cause heart attack and stroke. And we never meant to say that because it's a contributing factor to arterial disease and atherosclerosis. And that's the thing that we have to understand. It is a proven, I can give you lots of data on how these bacteria pathogens are getting into our system. And this actually goes all the way back to 1954. And when I explain this to hygienists, they're like, they take a deep breath first. Because we all know about oral systemic bacteremia. Medical doctors understand this, dentists understand this. But we have to understand that an increase of incidence happens. So 40% of bacteremia happens when the hygienist is in there doing her regular cleanings. Okay, so we as hygienists are the troublemakers for all that bacteria getting into the system. Okay, 35% of it is done through dental extractions, 24% of it is done with brushing and flossing, and 17% is done with mastication, with eating and eating. So if you've got an open wound, and that's how bacteria enters into the bloodstream. So when I share this, we've known this for over 6 decades, okay? But we've really not really changed our practices of how we treat our patients, and I can tell you this because I've been in dentistry for this long, for the last 5. We've really now taken this into account and said, you know what? We need to be more mindful of what we do for our patients, what we do for our diabetic patients, what we do for our pregnant patients that come in, and we just get in there, and hygienists, we're keeners, right? We see all the tartar and stain and bleeding, and we want to get in there and do our thing and get everything pretty and get everything off. But we don't understand that we're actually creating more problems when we treat patients that way. This was also done, this is the latest research came out with Dr. Bale and Amy Doney, December of 2016, and I can get you this, this data. And they basically have proven that now we've got, and I'll show you the slide. I can give you this, all the data for this, because I'd like to get to this slide to explain. There are periodontal pathogens. Now we know that there's about 8 of them that are strong pathogens that are destructive to our field, the periodontal disease. So these are, the top 4 are problems, strong evidence about periodontal disease. So patients have these, we know they're going to have a periodontal issue. And then the lower 4 are moderate pathogens. Now, what we found in that study that I just showed you before was AA, P. gingivalis, and Fusonucleatum bacterium are the troublemakers when it comes to cardiovascular risk. So we know now that the bacteremia, and they've proven this, they've opened up cardiovascular patients that have had an event, and they found these 3 troublemakers. So dentistry, we're being blamed for a lot of things, like we're blamed for cardiovascular disease, we're blamed for diabetes, we're blamed even for erectile dysfunction problems, right? And the problem is biofilm. Okay, these are the problem is the bacteria, right? So that bacteria gets into the system. So cardiovascular surgeons, and I'm going to tell you a funny story because I was on a plane going to Vancouver last February, and I'm doing my PowerPoint presentation and just cleaning it up, and I'm sitting next to a medical student from U of T. And so he's looking at my PowerPoint presentation, and I had my picture of bacteria, this and the artery wall, and he says, are you a doctor? And I said, no, I told him what I do. And I said, oh, are you a medical student? Because he's like, yeah. So we start talking back and forth, and he says, so what do you do? And I said, well, I help educate, medical providers and doctors and dentists about, cardiovascular disease, bacterium and everything, and inflammation. And I said, you must have learned this in school, right? What do you learn about cardiovascular risk and heart disease and stroke? Do you learn anything about oral health and its contributing factor? And he's like, no, I haven't learned anything yet about that. I'm in second year university. And so we were having a great conversation, and we were just educating back and forth. And it was a big eye-opener for me, because a lot of what we know in dentistry, the medical field really doesn't know. And I learned this also working with Dr. Bale and Amy Doneen. But this is the problem, right? The oral bacteria is a big contributing problem to overall health. And we know now that those 3 troublemakers actually get into the system and create problems along the arterial wall, just like cholesterol and all those other things, all those other issues. Now for me, I've been blessed to work with a microscope right beside my chair. And Abbas, where are you? Abbas had the experience live, and he was like, whoa. So I've had the opportunity to work with my patients and really help educate them on, the mouth and being the problem with your overall health as well. So if I can just push play just for a sec. The voice of this is Dr. Kennedy. You can just push play just for a second. Whoops. And this is what I show my patients live. This is what I show the boss. We can mute the, you can mute the actual voice. The voice on here is Dr. Kennedy. He's the one who trained me 25 years ago on how to use a microscope in your dental hygiene department. And so when I take a sample, when I do a full periodontal charting on a patient, I'll take a sample of bacteria and I show the patient what's subgingivally in the deeper pockets and the shallow pockets in their saliva. And this is a huge motivator for patients to actually take responsibility and accountability for their overall health. It helps patients understand the value of the treatment that I want to do for them to arrest the condition and get them better. But I can tell you that this biofilm is very, very tricky to treat, to break down. And I've been in hygiene for 25 years, and I started out with a Cavitron and some great instruments, and we really learned along the way that these pathogens and the bacteria were really difficult to break down. And so what we teach here at OWL in our hands-on course, just like what you're learning how to do really good restorations, is I teach hygienists how to actually help with the technology that we have today to make a better impact on this. Because one of the things that I found in hygiene is that I can get a patient perfectly, I can get all their inflammation down, and I'll show you some before and after pictures. I can get them perfectly, a perfect clinical exam, but then their bacteria burden is still there. And I'll show you a couple of before and after pictures. So getting back to cardiovascular disease, right? So it still is the #1 killer. And for me, the reason why I joined Dr. Bale and Amy Doneen was because I understood that there was more to it than just what our basic standard of care was, and that there was a big link to dentistry that was missing. And so one of the things that is a driving force for heart attack and stroke is inflammation. And we really know that now. And it's a concept that some cardiologists are just learning it now. But it's been around for about 10 years, the whole philosophy that it's inflammation that's going to drive that heart attack and stroke. And the inflammation can come from anywhere. It can come from arthritis, can come from other chronic conditions, but it can also come from an oral manifestation, from bad root canal teeth. When I coach dental hygienists, I always let them know that every time a patient is in and you're working around an implant or a root canal treated tooth, that you're always doing a full periodontal evaluation around those areas, making sure there's no exudate, there's no inflammatory response, frequent radiographs, because we want to find out if there's any problems in the oral cavity that would drive a heart attack and stroke. And there's many root causes of heart disease, of heart attack and stroke. And this is a cartoon from Dr. Bale and Amy Doneen. They love using cartoons in their presentation, and I can use this for mine. But the beauty of this is when you're looking at, we're not going to be cardiologists, right? But you have to know that there are things that we do in dentistry that can actually give us a little clue as to what's going on with the patient. And, you know, under all these root causes of atherosclerosis, you've got periodontal disease and endodontic disease. That's our arena. Sleep apnea. Okay, there's a lot of doctors that actually are, you know, doing sleep apnea appliances and sleep apnea protocols in their dental office, and they're becoming that whole person-centered care. But we have to understand that atherosclerosis is not just about cholesterol and high blood pressure. There's so many root causes, and we as dental providers are part of this little tree here, the roots. So it's important that when you're going to develop your practice and you're going to set up practice, is that you set up, programs and have modules for specific things to train your team, right? So again, it's like I said at the beginning, it's, you know, what arena and what perspective are you going to work from, okay? And you have to be mindful of your cardiac patients, your cardiovascular risk patients. Again, it's really not just about just the heart. The reason why dentistry is being blamed for so many systemic diseases is because of the 60,000 miles of blood vessels that we have from our head to our toe. And there's now research that shows our Alzheimer's and periodontal disease link. And it's all about how that bacteria gets into this 60,000 mile vessels that we have from head to toe, and basically these two bacteria are contributing factors to the decrease of circulation in your system. So we're, like I said, we're being blamed for just about everything lately. This is a real great study that came out about 10 years before I had a personal experience with my brother with this. And they talked about the C-reactive protein levels that came down after the completion of a standard non-surgical periodontal therapy program with a patient. And I'll tell you a personal story that I had with my brother 10 years before this study came out. I have two brothers and an older sister. I'm the third of four. And my older brother, I'm embarrassed to say, he had never been to a dentist. He's always this big CEO, too busy to get medical checkups, too busy to get any dental appointment. So he was buying a new company, and he had to have an insurance, all the insurance tests that they do when you're buying a new company. And so he came back home and he said, Sarah, the doctor put me on like 3 heart medications. He said my C-reactive protein level was way off the charts. And he said I was gonna have a heart attack if I didn't go on these medications. So he says, I don't really like these medications. I feel terrible. So I said, you know what? His name is Amadeo. We call him Amo for short. I said, Amo, call the office, get yourself an appointment. I was working in a practice I was at for 18 years. I said, come and see us. We're a very comprehensive practice, as he knows. We did a whole bunch of intake forms. We did x-rays, pictures, the whole measuring, microscope. We did a whole gamut of tests on him. And I remember the doctor I was working for him, Dr. Bloom at the time, stuck out his head and he said, Sarah, just look at your brother's pain. And I saw all this bone loss, around the back of all the sevens. He had one wisdom tooth that had to come out, so I knew 5 teeth had to come out. He said he had no cavities. He had never been to a dentist. 43 years old at the time, never been to a dentist, not one cavity, but he had massive bone loss, massive oral infection. So I did my little thing. I did my microscope, I did my disclosing, I did pictures, I did a full periodont charting. He was totally infected. I did my treatment plan for him. We had done about 4 active therapy programs on him. We did nutrition, we did oral self-care. We put my brother back into great shape. In 6 weeks, he comes back, and I'm telling you, it was like a little light switch went off. His gums, there was not one area bleeding on probing. The connective tissue just went whoop. He was really, really nice and healthy, and his home care was like amazing. He decided he was going to go off all his medication that day because he said, this is what the problem was, Sarah. C-reactive protein is high because of this. So Dr. Bloom and I advised, you know what, don't do that, because go back to your cardiologist and, get the right help. But he didn't listen because he was feeling terrible. Never had taken medication, but he felt terrible. So he goes back to the cardiologist, and the cardiologist said, well, you know what, Amadeo, that your medication is working great. He said, because your blood levels look fantastic. And my brother says, no, I went off those medications about a month ago. And they explained what happened to him. He says, I went, my sister works in a really comprehensive dental practice. She did all these tests on me. I had advanced gum disease. It was an active infection. They cleared it up. I'm doing my great with home care. And then they changed his eating plan, went on vitamins and everything. The cardiologist looked at him and he said, your sister probably saved your life. And so my brother, now the beautiful thing that happened there was my brother is now the biggest ambassador of our practice, and he refers like every one of his patients. And all of them are mechanics that don't take care of themselves and they need the help. But the best thing for me was that the doctor now affiliated with Dr. Bloom, and they connected with a great relationship. And so this doctor now refers to Dr. Bloom, and they have a connection. So we educated that doctor about what we did, and he understood. And this is the thing, this is like my mission of OWL, really, is to help bridge this gap. Okay, I know it sounds like a big altruistic dream, but I think that if we can do this in dentistry, and it's really going to be from our side, is to help the medical side. The thing is that, when you have that kind of connection with medical providers, you get a lot of influx of new patients. And these new patients that come to you, and I work right now in an integrative wellness clinic where I see it every day. The patients that come to see me that are referred by our naturopathic doctor, our physician, that have a cardiovascular risk are coming because they want to get this looked after. Because this is part, exactly, you're with me. Yeah, this is part of this. And so the patient is not going to be, most of my patients are not nickeling and diming me about how much insurance is going to cover and what is this going to cover, because this is part of this. And I know kind of the doom and gloom, about so many dental offices and this, it's not the truth. The truth is you're going to be healthcare providers, and it's your job to help align with medical providers to help get patients healthy. And when you have this perspective and this wish for your practice, the revenue is going to come. Your return on investment is just a byproduct of what you do when you do the right thing with your patients. And there are lots of people that have cardiovascular issues, right? There are a lot of patients that are on high blood pressure medications. And there are a lot of patients that are on high cholesterol medications. And we can do a better job of screening them, and operating from the point that we're going to help you make sure that this is looked after. Because I always tell my patients, I'm not a cardiologist, I don't pretend to be one, but this is my arena. And this is what I'm going to look at to make sure that I'm going to arrest as much as I can arrest. And it's not easy. But this is a great tool. This is from the Cleveland Clinic, and I have this laminated in my office when I do a presentation to a patient, especially if they've had like a heart attack or they have any disease. I explain to them that this is all the stuff that's accumulating in your arteries, and there's certain bacteria in your gums that actually get into the system and clog up the arteries, just like this. And then these are some tests that can be done along the way that, you know, we send. And our office is great. Like, again, I work in an integrated clinic. So, you know, when I see a patient that has an oral infection, we can send them, you know, the data that we would like to see as far as a medical test goes. And we're kind of, you know, bridging the gap and working together to help this patient. The other thing, we'll talk about all the tests and stuff that are available, but diabetes, this is the next area that is huge. Okay, the research that is coming out about diabetics and oral health and diabetes, every day there's new data coming out. And for me, the diabetic patient in the dental practice is the most compromised, in my opinion, because there's, you know, 3 times greater risk of developing periodontal disease. They're more susceptible to any kind of infection, not just oral infection. And periodontal disease is known to be the 7th complication of their overall health. It costs healthcare over $153 billion, and they're estimating that in another 10 years, that's going to triple. Basically, you know, a person can have high sugar levels for many, many years before they're full-blown diabetic. And now doctors are coming up with that term pre-diabetic, which is always funny to me because it's kind of like you're just almost a little bit pregnant. And actually, I'm looking at getting, you know, and this is something that some dental offices are doing, and they're checking blood sugar levels, you know, at the beginning and the end of appointments as part of their new patient screening as well. They're doing high blood pressure, they're checking their blood sugar as well. But going back to the 7 complications, like these are the other things that happen with diabetic patients, right? Their vision problems, their kidney problems, their macro coronary artery deficiencies. So they get all these problems, right? Complications to resistance to infections, right? Because there's so much glucose in the system, in their blood levels, and their oxygen level goes down, their white blood cell comes up. So it's really like a perpetual problem when they go year after year, month after month with unstable sugar levels. Because blood sugar really should only be in our cells. It shouldn't be free floating in your system, in your arteries. So what ends up happening is with your diabetic patient, your dental diabetic patient, is that you're doing this dance where you're the dog chasing its tail. Because when the diabetic patient isn't controlling their sugar level, their periodontal disease gets worse. And as their periodontal disease gets worse, guess what? Their sugar levels are harder to control and their medications don't work. So you're doing this dance between, like, you know, this isn't working and this isn't working, and you've got this bi-directional problem going on. When it comes to, oh sorry, I went the wrong way. I think when it comes to oral implications, right, they get more tooth decay, they get rapid alveolar bone loss, they get dry mouth also from the medications, and because they have a higher sugar content in their system, guess where the sugar content is also high? It's also high within the crevicular fluid. So that's why, you know, if you've got a high sugar content in your crevicular fluid, you're going to attract certain microorganisms that feed off of sugar, and they're not nice ones, that's for sure. So they get other problems like lichen planus and ulcers and stomatitis and candida and thrush, and their mouth could be like ground zero, okay? It can be not a nice place. So I've coached many offices, right? I coach all around Canada, and I've heard hygienists, I'll stand behind them, they'll have a diabetic patient and they'll be bleeding, you know, it's like you gotta call 911. And I'll hear them say, you know what, well, Mrs. Jones, your gums are bleeding because you're a diabetic patient. And that's it. No solution, no help. Okay, then you know, we backtrack and help them understand that yes, we put a system in place with technology and oral hygiene and nutrition, these programs into your office to actually help this diabetic patient. And I'm pretty sure I put them on a case that I did on my slide show here. Again, we talked about that. So this is what I was talking about, the bidirectional problem, right? So you got the perio doesn't get worked out, medication doesn't work. When the medication doesn't work, the perio gets worse. So you got this dance going back and forth, and it gets very frustrating. So if you're in an office that doesn't have the ability or the tools or the technology to help finally arrest the perio condition, well, you're just going to be saying what that hygienist said to the patient. Well, they're bleeding because you're a diabetic patient. And that's why they're going to bleed. Like that's the answer. So you got to live with it type thing. Well, you don't have to anymore. This is a diabetic case that I did. Okay, it was actually referred to me by our naturopathic doctor. So the great thing was when I entered into this integrated wellness clinic, I'm just going to watch my time. I trained the whole team, the medical providers, of what I do. Okay, I'm not just cleaning teeth here. I'm actually going to help work with you to get your patients healthier. So Tammy, the doctor, our naturopathic doctor, saw this patient that sought help to get her gums healthier. And so this patient, she was going every 6 months, and she hated going to see her hygienist because she was feeling sick after. So knowing what you know now about bacteremia, like how sick would your diabetic patient be if a hygienist went in there and started doing her thing and blood going everywhere, and then put prophy paste and polish her up, see you later, we'll see you in 6 months. Okay, she was feeling sick for weeks after weeks. So she said, Sarah, if you're going to put me on a program, if you're going to fix my gums, I'm not going to do it because it hurts too much and I don't want to do it. And it took a lot to convince her that this is affecting her diabetes. So we did it very gently, okay? We use laser treatment. I'm not going to get into all the treatment and technology because that's a whole other day. But we did what we did in our office because we have the system in place. So we spent the time on nutrition and oral aids with her and what she was going to do at home. A whole separate appointment that people pay for, okay? This is actually something you can put in your practice that people will pay for this service, and it's a valuable service. And then we did treatment step by step with laser, piezo, medication, laser-assisted therapy, special treatment to desensitize her at the end of the appointment, and we did it every 5 days. We had her do this procedure. And then we also put her on an antibiotic mouth rinse to actually help with the bacteria as well. At 6 weeks, this is what she looked like. Okay, to me, she's not perfect yet, which we're not going for perfection, but for me, I'm the inflammatory kind of detective, right? I don't want to see any inflammation. So on a recare visit, she's in the office every 2 months. And every time she's in, her protocol is a medicated treatment, and we're putting the laser to any areas that are inflamed just to help her. And we're rebuilding and remineralizing, and we have her on good agents at home to help her decrease her cavity rate. She is thrilled. She has more energy now. Tammy works really well with her diet and some supplements and things. She had to go off 2 medications, okay? That's huge. She went off 2 of her 4 or 5 medications that she was taking. She feels amazing. Her blood sugar is stable. And this is when you get a patient, a diabetic patient, that has healthy systemic, like their blood sugar is stable, their connective tissue responds beautifully. When it's in the reverse, you're not going to see this kind of outcome. But you have to do it very carefully, right? Because we don't want to flood the patient with, just like a general kind of cleaning and then send them off. So she was a great case, because one of the things, and I show this picture, because one of the things, I'll go back to her here. One of the things when I talk to my patients, a diabetic patient, and to doctors and medical providers, is that when you think of the mouth, okay, the mouth has connective tissue just like we've got connective tissue everywhere. Now if I took out all these teeth and I just had the surface area of the gums, the gum would be basically about the size of the palm of my hand. Now if I took that wound and I put it on my ankle, okay, sorry, this patient, would probably be in the hospital, IV, possible foot amputation. It's the same thing, right? This is the same size wound as that. When you talk to your patients that way, people start looking at it differently. And that's our job as healthcare providers, oral healthcare providers. Now I'll just tap into rheumatoid arthritis a little bit because rheumatoid arthritis is a disease of inflammation as well. But the one thing that most medical providers don't understand is that they have the same receptor cells that turn on rheumatoid arthritis also turn on periodontal disease. They have the same toll-like receptors. So in Ontario, about a couple years ago, our association did a great ad, and they ran it for a couple years saying that your dental hygienist is your first line of defense if you have rheumatoid arthritis, because of the research that shows that the inflammation is the same receptor cells that turn on inflammation for rheumatoid arthritis that turn on arthritis and periodontal disease. It's the same thing. So if you help somebody that has inflammation, and that's why as a hygiene, in your hygiene team, in your hygiene program, you want to be that inflammatory detector. The only way we can find out inflammation is by looking at your gum measurements, looking at the tissues, what do they look like? And most of our offices now understand that we don't want to see bleeding on probing is got to be to nil. That's where the standard is now. When I first came into hygiene, it was like, yeah, well, because we didn't have solutions and we didn't understand 25 years ago. So everybody was on a 6-month recare. We're just cleaning them up and sending them home. As long as the tartar and the plaque was off, it was fine. Okay, the roots are smooth, you're good. We weren't really concerned about inflammation as we are now, because we understand that inflammation now is the problem for many other root causes. This is gaining huge headway, and I think I put it up yesterday because it just came to me. I put it up very quickly. I didn't even put the year on it, but this just was out about 6 months ago. Intrauterine infections are really a problem with women getting septic just before they have a baby. And it's becoming more known that it is a problem because a woman that has intrauterine sepsis just before labor is a huge risk for the mother and the baby for death. And guess what? The bacteria, the problem, again, us, it's the fusonucleatum problem, right? Comes from the oral cavity. This is another thing that I coach my hygienists over and over again. You have your pregnant patient, you want to get them healthy prior to any pregnancy. You want their gum tissues healthy. Because if you're trying to get them healthy during pregnancy, so if they're unhealthy before, believe me, with that 75% blood volume from pregnancy, they're just going to get that exaggerated response. But the problem is, remember what we talked about in 1954? The bacteremia that is done, 40% of the bacteremia that is induced is through hygiene. You get a patient that is not healthy during pregnancy orally, and you keep, bringing her in every couple of months because her gums are bleeding, you are going to induce this problem. And it's a serious one because I've had a couple of patients in my own practice that came to me and had this issue, and they didn't really trace back why. Why was it until they came to me. And now one of the things I want to talk about is the oral DNA testing, right? Because how do you know if you don't have these systems in your practice, how do you know if you've got patients with this in their saliva, right, in their DNA? Well, guess what? We're so lucky, and it's been about a year. In Ontario now, in Scarborough, we have a special test. It's a simple little saliva test that we do that can test for those 8 bacteria that I talked about at the beginning. So, the one thing that we're getting better at is in dentistry is our diagnostic ability, okay? The better off you can diagnose someone and use diagnostic tools, the better your outcomes are going to be. That's in medicine in general, right? I think in medicine, the better the diagnostic ability of the doctor is, the better outcome for the patient. When they're just like shooting at stars and just grabbing here and grabbing, oh, well, I think it's this, and we'll just give you this, the outcome's probably not going to be that great. But now we have, like I said, I've used a microscope beside my chair the whole time. Now I can do oral DNA testing. So my cardiovascular patients, diabetic patients, patients that are planning to have a baby, I'm doing all these DNA tests on them. So I know what I'm dealing with as a hygienist before anything happens. But this is like a huge one. Like I said, I just put this up last night because it just came to me. Because this is what's causing preterm births, miscarriages, sepsis just before labor. It's these bacteria that get into the system, get into the amniotic fluid and contaminate the uterine wall and will trigger that incident to happen. Smoking, I think we were talking about this as part of being like an entity in your dental practice, right? Smokers, and the best place to have a smoking cessation program is in your dental practice, okay? Because when you help a patient quit smoking, you help a lot of the conditions in their mouth, right? Bone loss. Same thing as the diabetic, right? Their mouth is dry. They're going to get different bacteria because their mouth is dry. They're going to have alveolar bone loss. They're going to have all these complications. So if you offer a service where you can have a patient come in and, you know, it's going to be a paid thing that they can help quit smoking, you're going to help prevent a lot of diseases down the road, but you're going to actually help their periodontal condition. Again, I know Dr. Eisner talked about medications and dry mouth and xerostomia. Now, we're getting really technical, and we have to become better healthcare providers. And this means, you know, taking courses on pharmacology, because there are so many medications that patients are on. I mean, I had a patient on Saturday that I saw, and she was on about 12 different medications. And I prompted her to please seek help with her medical provider to see if she still needs all these medications. Because what happens over time is that a patient will see one medical provider and another, and there's no coordination between any of the doctors. And meanwhile, the patient's on 12 medications. And so the daughter was there, and I said, you know, go to your family doctor and make sure she actually needs all these medications, because the interactions between all of them, and I should have brought her picture up. That's the picture I sent you about that patient. The oral manifestations of what goes on with patients that have all these medications is great, is huge. And so us, like I said, we can't just think of ourselves anymore as just dentists or hygienists or assistants or admin team. We are all part of this healthcare paradigm, and it's shifting. And I can tell you that when you look at your patients as a whole person and you treat them that way, you will have a patient for life. And they will never leave your practice because they know that they're in good hands. And I see it every time when I see patients come into my practice and we just do our new patient experience that we do, they are just leaving with their mouth all. And all we've really done was maybe did a perio chart, we did the microscope, what I think is just basic standard. But we take the time to walk the patient through. And medications, people are on so many medications these days. You know, a lot of antipsychotic medications patients are on now, and they have huge oral implications for dry mouth. You know, you'll see a lot more lichen planus, stomatitis, all kinds of issues. And your dentistry won't last as long. So you have to have things in your practice that have, you know, a component to helping, you know, the patient with those. Because, you know, it's not just like, you know, like when I started dentistry 31 years ago, I mean, there was one dentist for, you know, like miles and miles, right? So we had one practice could have like 4,000 patients. I remember working for Dr. Chandler. We had 3,200 active patients. We were busy, so you really were just busy just doing, you know, drilling and filling, and it wasn't until he stopped and said, you know what, we're gonna do something different for our patients. You know, when you're that busy, you're not really focused on, you know, what system am I going to put in my office that, you know, is really going to benefit my patients. Now we have the ability, we have the time, you know, If you have 500 patients, I can tell you, you treat them the way that they're meant to be treated, and you will have a growth that you would not ever imagine. You don't have to have 4,000 patients to do $2 million or $3 million in sales anymore. Like I said, when you set your office right and you do what's right for the patient, the money is just a side thing that comes because you're focused on the patient. And we need that more now than ever because there's a lot at stake. There's a lot at stake. You're dealing with patients that are, pregnant, that as a hygienist, I can actually cause the problem to induce problems later. We have to kind of take a bit more of a mindfulness here. So this is something that, I'll just take just a few more minutes. This is a real big eye-opener, right? Because I did an article, I think last year, about oral hygiene and how I think that, oral hygiene is not just what we need to do in hygiene to get our patients healthy. And so I put this together myself to show what biofilm looks like at the beginning of an appointment. After I spent 35 minutes cleaning, just a regular scale with the ultrasonic, and then what it looked like after an hour of treatment. And I just need a little bit of help here. Boss, okay, so I think I could do it myself. So this is basically, again, this is one of my videos that I've taken with my patients. This is what biofilm looks like when you take it out of its hibernation. You see white blood cells, red blood cells, some of the moderate risk bacteria. So that's what it looks like at the beginning. So afterwards, after about half an hour, wrong way. Okay, after I did 35 minutes of debridement, this is what we did with you, Abbas. It wasn't yours, though. This is not your slide, don't worry. This is Abbas. When he came to visit me in my office, it was a new thing, looking at a microscope. He's like, wow, this is what you do for your patients? I said, yeah, let me show you what it does. So after half an hour, there really wasn't much change in the biofilm, right? Because biofilm takes a while to actually break up, and you need to use a really good ultrasonic instrument. After an hour in just one quadrant, this is what it looked like. Okay, now the reason I actually show my patients even before and after, because I let them know, like, look at the work I did for you, okay? I took your threshold down to basically nil. Now it's your part. Because this is why I actually, when I teach hygienists and I coach, I let them know that they're just regular visits that they're coming in for, whether it's 3.5 units of scale or 45 minutes or an hour, is not enough. And it's always been my opinion of 25 years that the reason why there's so much perio is because we don't do a great enough job when they're in the chair. And so once I put this together, people kind of, understand now. Because if you don't take that threshold of biofilm down to a safe level, okay, like this, it doesn't matter what they do for home care. Because if we look at the previous slide, okay, if I just took it down to this level, what is my expectation of what's going to happen? Because I know this biofilm is still active. They're going to communicate back and forth, and within you're very sharp. Within a few weeks, it's going to be back to an unsafe level where we see inflammation and bleeding, and then the patient comes back in every 3 months, and what's the hygienist say? Well, you're not brushing and flossing, and it's their fault. And it's not their fault. Then you take the component of oral biofilm when you check their DNA, and if they have fusonucleated bacteria or P. gingivalis in their DNA, well, they could floss until the cows come home, and that's not going to happen. So this is really important to understand. When you're putting your hygiene programs in place in your practice, you have to understand, like, what are you treating? What are you doing? And now, 25 years ago, we didn't have DNA. Not many offices had microscopes. They didn't understand what they're dealing with. They were just, every 6 months, half an hour cleanings in and out. And that's why I think there is so much perio. So we can't blame the patient, right? Because if you don't take that biofilm down to a safe level, it doesn't matter what you do. So this is another soft tissue management before and after. And I bring up these last few slides just as we want to help that you're always going to do the best thing by the patient. Okay, so this patient came to us, new patient, His wife was a patient of mine for 5 years, and then when I met her husband, I understood why I couldn't get her biofilm better, right? And I was begging her for years and years, please, let's check your husband. It'll just take 2 minutes. I just want to do a sample, and then we'll go from there. Finally, he came in. But John came in, and he just wanted that front tooth fixed. And many dental offices, many dentists, and I hope you're not going to be any of them, would do that for him. They would say, yeah, we'll fix that for you. The dentist that I worked for at the time when we did this, he says, John, that's great. We're going to get to that crown, but it's not going to be till at least 3 months. So you got to make sure your gums are stable. We got to make sure that, everything is going to resolve here. Didn't jump in just to do that crown just because the patient wanted. And many dentists will do, a filling over inflamed bleeding gums. And then we'll deal with the perio later. Many will do that, right? And it's about having the integrity to understand that your work won't last if you don't look after the perio and the oral hygiene first. That's always got to be step number one. Because your hygienist will kill you if you don't. Because if you put a filling in a tooth where your gums are bleeding and you can't get a good margin, that's going to be a perpetual problem for her. So I often said that, no offense here, I always say that I think that you should become a dental hygienist first. They got the program wrong. I think you should be a dental hygienist first, practice for a few years, and then go into dental school. But it's really, this is a big case. This was like a $2,400 paid soft tissue management case. And this is what I tell you, when you have the communication skills, you have these programs in your office, they have a value to it from a revenue standpoint, but the patient gets absolutely healthy with the technology that we have today. That's what John looked like. This was not even at the 6-week evaluation because we took this picture at the insert of the crown. And many dentists say, Sarah, I don't know how you did that case without surgery. Okay, it was like I was doing surgery because of, where the tissues were. Right? John is a great before and after case. This is a young boy, 18 years old, that we did, was seeing a dental provider every 6 months, and because Manulife only covers 1 unit of scale, that's all this office was providing. And this boy was going, this is bleeding on probing. This is not, I went and scaled. This is after I probed. Mother almost fainted when she saw him. What I did with the treatment that I did with laser and all the great technology we have today, this is what Gabriel looked like 4 days later. That wasn't even like a week later, 2 weeks later. I took this picture right away when I saw it. Because I've been a hygienist clinically for many years, and with the technology that we have today, we can get these results. And they're long-standing results. Because when you remove that necrotic tissue, you're going to get better healing long term. If you just go in and try and scale and get all that tartar off and you don't remove that necrotic inflamed tissue, you're not going to get results. And this is Lisa. She has followed me for about 20 years in my career. Wherever practice I go, she follows me. This is what I maintain every 3 months. There's no inflammation. I want to keep her healthy. Now Lisa, she has a very strong cardiovascular risk history. Her mother and father both have cardiovascular disease. So we did her DNA as soon as it came out, and she actually, with her perfect clinical exam, came back with a high P. gingivalis count within her DNA. So this is where we're shifting in hygiene, right? You can have a perfect clinical exam. Everything can look perfect. And I can check your DNA, and you can come back totally infected. And this is where, hygiene is actually going. So we treated her for those pathogens, and now she's in on a routine basis, and we check it every 6 months because those fusonucleated bacteria, P. gingivalis, is going to get into that bloodstream just like cholesterol, and she's very proactive, very health conscious, so we made sure. And that's what I tell my patients now. I have the technology and the knowledge now. If I didn't do it, it's the prudent thing to do. If I didn't know that, you're going to get pregnant next month, and that, you know, I have a test that can actually see if you've got this bacteria that can contribute to a problem with your pregnancy. Would I not tell the patient? Right, and that's where we've evolved. So in my journey of 31 years as a hygienist, when I look back when I first graduated and how I was treating my patients and how we've evolved over 31 years, it's amazing. You know, I can really help someone prevent having a heart attack, someone maybe preventing a miscarriage, which is very traumatic. So when you operate from that way, you will have the patients for a lifetime. And a wonderful practice and a fun practice. So I'm excited for you all, because I really am, because it is an amazing profession, dentistry, and it's going to get even better and better. I have two boys, an 11-year-old and an 18-year-old, and I'm begging that one of them will go into dentistry, but they tell me my job is gross. I put my hands in people's mouths. So I'm excited for you all, and if ever there's anything, any information or anything you need, just give a ring. Thank you.
Thank you.
Any questions? Good time for a whole hour. Any questions or anything?
Thank you.
Oh, you're welcome.
Where's the clinic that you work in?
So I work in the High Park Integrated Healthcare Clinic in Toronto, downtown Toronto, right on Bloor Street, across the street from High Park.
In case of
And it's like right around the corner, like I tell you, in where we are, I have a dentist around the corner, and I have like, there's like maybe like 20 dentists within like a 50 like meters. Yeah, it's very packed. But we're very unique, right? We're unique, and so, you know, our new patient flow is tremendous because of our uniqueness. So it's really, we created a niche, but patients really want that service. They want that whole percentage. But I do coach, like I work out of another company called Denmat that puts the technology together, and there's a lot of offices that are moving into this model, and I work with about 50 offices a year. So they're getting better at you know, wanting to put these systems in place to help their patients because they understand. And many of them have borrowed my PowerPoint presentation to go over to a medical doctor and do a presentation and get, you know, because there's many dental offices that have an adjacent medical facility in the same building, in the same plaza. And so I call it medical marketing, right? It's really for me, it's about getting the patients healthy. Yeah. So, yeah, no problem.
Thank you, Sara.
Oh, no problem.